So over the course of time, with the pandemic, we've lost our normal rhythm of life. There's a training session in off season, and you play in the season, and you go on, right? So you're used to using your body more regularly in a more regular manner, right? But with this disruption, athletes, they're really not playing like they were, right? So people become deconditioned. And as a sports specialist, I can tell you things like ACL tears and that sort of thing, that when they happen more commonly to people who are deconditioned.
So the main exercises that people do are intrinsic stretches and tendon gliding exercises, which if you've ever been in to see me in the office, I show pretty much everybody. But essentially they're exercises to stretch the little muscles in your hand, which can also affect the nerve, as well as to put your tendons through a full range of motion, so that they're gliding better. So there's inflammation within the carpal tunnel. They won't stick together, and the symptoms will usually improve with that. And we have hand therapists here at OrthoVirginia who can take you through those exercises, or give you a home exercise program. And again, I show people in the office these exercises all the time. They're easy to do.
So just a couple tips to help reduce your risk of developing sciatica. Maintain a good posture with sitting, standing, lifting heavy objects or lifting any objects for that matter, and even sleeping. That'll help offload pressure off of your spine. Exercise regularly. You maintain the flexibility in your joints and strengthen your core, and the muscles that are supporting that spine will be incredibly important. Make sure to maintain a healthy weight.
So we call this strap maintenance. When you take your brace off, if you will stick your strap back on itself, it will keep you from getting all your dog hair or cat hair or anything like that all stuck up on your brace, because then you end up having to pick all that off.
So preoperatively, the education piece is very important. We give each patient preoperative exercises to perform before the surgery to help strengthen the muscles around the knee and the hip prior to having the replacement. This helps tremendously in the recovery. In addition, it shows the patients prior to having surgery what exercises they will be doing after surgery.
That's a basic review of worrisome signs and symptoms, as well as some basic case examples. I guess the take-home points, which I've reiterated a few times, is obvious things: severe pain, deformity, any cuts or lacerations or bleeding near an associated limb injury need to be taken seriously and really do warrant immediate attention. Most injuries, however, are not severe, and they usually can wait and just do the basics of musculoskeletal care. Again, rest, at least rest, ice, elevation, sometimes compression, depending on where it's located. But if there's any question, obviously, certainly seek medical attention.
Speaking of pain perception, psychological health is extremely important to managing someone's pain. And the reason for that is, and many people don't know this, is that 70% of the centers in your brain that are responsible for the processing, the management, and the interpretation of pain signaling are also redundant, which means they also do emotional processing. And so, something that I tell my patients is that, let's say that you had just won the Powerball today and someone comes in and punches you in the arm. Imagine what that would feel like versus you just lost somebody who's very dear to you and somebody comes and punches you in the arm. It's going to be a very different pain experience, and that translates to chronic pain just as well.
Things that help to promote bone density are a good lifestyle that includes diet and exercise, especially weight-bearing exercise that puts stress on bone. That helps to build bone and increase the density of the bone, especially when we're younger. Avoiding things that are known to possibly impact bone health, like excessive drinking, smoking, those types of things as well.
The robot, to me, makes me a better surgeon. I think it makes me much more precise. Prior to the robot, the traditional method is to eyeball it, and so I thought, why not have more information? Why not have information that gives us a better sense as to the patient's alignment in real time, mobility, customize the surgery to the patient, and in my opinion, also have reproducible outcomes.
The first place that we always like to start is a good history. And oftentimes, if we just listen, the patient will tell us exactly what the problem is. So what we're looking for is the nature of the problem. Where is the pain? Is it in the shoulder? Is it back, front, side of the shoulder? Does it radiate down the arm? Does it go up into the neck? Is there numbness or tingling?
The most common question we get when somebody presents with a bone injury is my bone fractured or broken? To which I reply that it's actually both. They do mean the same thing. That is then followed up with the second most common question, usually from the patient, are you sure, doc, that there is no difference? And I'm here to tell you there is no difference. It is the same thing.
The other thing that a brace does is that your brain can only factor in certain senses at a time. And it really doesn't like to factor in pain if it doesn't have to. So with a brace, it can provide pressure to the knee and to the skin around the knee. And a lot of times that pressure sensation overtakes the pain sensation. So it's like if a tree falls in the forest and no one's there to hear it. So you can still have pain, but the brain doesn't experience it.
One of the big key differences between sports that involve walking and running is that during running, there's never a phase in which both feet are on the ground at the same time. So when you think about that, running is truly a single leg sport. In order to do that, we have to have that good foundational foot and ankle stability, as without it, we can compensate up the kinetic chain using altered movements, which could then lead to injury.
So when you're young, it takes quite a bit of trauma to cause an injury to the meniscus, such as an ACL tear or high energy sports injury. And when you get older, you can tear your meniscus just by squatting down to pick up a dog toy.
You have an ACL tear and you're trying to figure out how to treat it. The important thing is to honestly assess what your aspirations are for sports, what your job is, how much time can you afford out of work, when you need to get back to your season to play. And those definitely help impact your decision making in terms of what you do for your ACL tear.
As Dr. Klein alluded to, the days of long inpatient admissions we realize aren't necessary. We look for rapid recovery. We look for better pain control during surgery and after surgery with our anesthesia colleagues who have made big strides. We look at getting patients, we use new techniques in closure of the wounds. There are a lot of things that have been driving us. And what we're starting to realize is that we can do that incredibly safe if we have the right patient and indicate the right person.
Urgent care versus emergent care. Right now with COVID, everybody's feeling a little anxious about going to the emergency department, and that's totally understood. We're here to fill that need of these acute sports injuries. And we want to help, again, those patients kind of stay safer and get their treatments a lot faster and in a more appropriate setting. Emergency room care is for life-threatening situations.
Most of the people that I see are people that are not coming to see a spine surgeon, they're coming to see a spine specialist. And I think that's an important distinction for everyone to understand, that if you're seeing a physician that does surgery, most of the patients that they're actually going to be seeing are people that they recommend alternative therapies for, because spine surgery, while it's safe, it's excellent, and it really's got great outcomes, the percentage of people that need surgery for their neck or their back is really very, very low, less than 5%, frankly.
We used to think that holding long stretches for a long period of time before practice was a great idea, but now the best way to warm up that we know is more of a dynamic warm up. So usually what I recommend is kind of like a light jog or a bike, something like that. And then instead of a static stretch where you hold something, kind of taking through the motions. And sometimes when I have athletes come into the office, we'll do that together and make recommendations and see what kind of is the best fit.
All of us as orthopedic surgeons would agree that at the end of the day, we are here to serve other people and to try to make other people's lives better. And having the opportunity to do that in the military with deployments and with taking care of the special operations community and working with them really kind of highlighted that to me and reminded to me that that's what we're here for.
Running does not make your arthritis worse. Running actually reduces arthritis-related pain. And there's even some data that suggests that runners have thicker cartilage than non-runners.